Tuning fork and its tests. Types of tuning fork: Hartmann's tuning fork, Gardner-Brown thumb rest tuning fork. Frequency of tuning fork. Tuning fork with frequencies 256, 512 and 1024 are used to know the level of deafness. Routinely, 512 is used as it is mid-speech frequency and its tone decay is minimal and there is no overtone. Less than 256 is used for CNS examination as it is better felt than heard. So 128 is usually used. 256 is and above are used for ENT examination. 1024 is used for cochlear examination. Holding of tuning fork. Grasp it firmly at its end but keep your fingers relaxed. Bend your elbow while holding it. There shouldn't be any tension in your arm. Hold the tuning fork on its side so you are striking only one of the prongs. Striking of the tuning fork. Strike the prongs of the tuning fork gently at the firm surface like elbow, patella or sole of the shoe. RINNE'S test. Strike the prongs and place the vibrating prongs of the tuning fork 2 cm away from the external auditory canal for air conduction. The moment patient stops hearing sound, base of the vibrating fork is transferred to the mastoid process for bone conduction. Same thing is done in reverse order. Air conduction greater than bone conduction in normal subject and in sensory neural deafness. Bone conduction greater than air conduction in conductive deafness. Air conduction is equal to bone conduction in mild conductive deafness. WEBER'S test. Place the vibrating fork at the midpoint of the forehead or vertex or midpoint of your chin or at incisor teeth. Ask the patient which side it is heard. Better heard in diseased ear. In conductive deafness, it is lateralized to better ear in sensory neural deafness. Absolute bone conduction test. Ask the patient to close his external auditory canal by placing tragus by finger and place vibrating tuning fork at the mastoid process. When the patient stops hearing it, it is brought to examiner's mastoid process and while keeping external auditory canal closed by the placing tragus by finger. Absolute bone conduction reduced, sensory neural deafness. Absolute bone conduction not reduced, normal ear and in conductive deafness. SCHWABACH test. Test is done in same manner as absolute bone conduction test, but in this test, external auditory canal is not blocked by finger. Interpretations are same as absolute bone conduction test. Thank you.